Hello, STEM Strong team. As we continue preparations for in-person learning for the start of the new year, we want to provide you with as much information as we can with as much notice as possible. This video will provide you with a reminder of some of the procedures already in place, as well as outline some of the changes that have been put out by CDPHE and Tri-County Health. As a reminder, here are the symptoms to look out for as it pertains to COVID-19 for each individual that you can find on the at-home screener. One of the most important symptoms to watch out for is the critical symptom of new loss of taste or smell. Any individual who is experiencing that symptom will be dismissed from school right away and move into isolation for the recommended period of time. For any individual who is experiencing a major and/or minor symptom, they will be dismissed from school and have to follow the return to learn flowchart in order to return back to STEM. What about those who came in contact with that person? Well, there's a new stricter procedure for that. If any individual who is sent home has the critical symptom, the close contacts around that individual will be immediately sent home as well and must move into quarantine. Additionally, any individual who has any of the major and/or minor symptoms and is in close contact with someone who has COVID-19 will be sent home immediately, and the close contacts will be moved into quarantine. The detailed What Happens to Close Contacts flowchart details next steps and has been provided to all staff, students, and families, so please review, print, and post in a visible place for reference. The Who is a Close Contact chart outlines the process that must be implemented as it pertains to contact tracing. Administration will use this to help determine who needs to be quarantined. It also details procedures for teachers to implement in their classrooms and how parents caring for their sick kids at home can minimize the transmission risk. The Return to Learn guide that was introduced prior to Thanksgiving break has just a slight change. You'll notice that a new color has been added to the dial, and that would be purple, which indicates extreme risk in the community. The rest of the flowchart is mostly the same. And the last flowchart that was sent out is a guide that will help determine what to do if a student or staff member appears unwell after arriving at school. You'll notice that loss of taste or smell has been added to the top of that chart, and then it goes into the decisions that our administration would make depending on the level of symptoms. If a student is experiencing any of the symptoms during a teacher's class, the health assistant should be notified immediately via the front office so that an assessment can take place. We realize that there's a lot of information to take in, and that's why our interim middle school director, Anna Magli-Haberek, put together a helpful video walkthrough of all the flow charts I just highlighted. You can find the full video in the STEM staff newsletter and on the STEM Communications YouTube channel. Let's take a look at a clip of that where Anna talks about what a staff member is to do when coming across someone who is sick.
So if someone appears or feels unwell after arriving at school, the first question is, does the individual have a loss of taste or smell? That's considered a critical symptom. If the answer to that is yes, that person needs to put on a mask if they're not already wearing one, and arrangements need to be made for that person to go home. Inform parents, have parents come pick them up, assist the student to the quarantine room. That's bullet 3 here. And students and staff who are sent home should contact a healthcare provider and ask for COVID-19 testing. Okay, so if they don't have a loss of taste or smell, if they have any of the major or minor symptoms listed above, we're going to move yes. Let's say they have any of those major or minor symptoms. But then what if all the symptoms are consistent with an existing chronic condition? So an example that's been given here is, what if a student has asthma and they regularly cough? And that's part of their normal everyday experience. If a student regularly coughs, that's part of their baseline, you would move over here. But if this is a new or worsening cough, then you're going to move over here. So if they have any major or minor symptoms, and those are new, they're not chronic, you're going to make sure they're wearing a mask and arrange for that ill person to go home. If the symptoms are part of their baseline, that student may be with asthma, chronic cough, you're going to follow routine illness care, return to class if appropriate, alert the teacher to monitor the student with heightened awareness, and just the health assistant will record the visit in the usual manner.
Again, you can find Anna's full explainer video of the COVID-19 procedures in our staff newsletter and on our YouTube channel. And in the days ahead, keep an eye out for additional content that will show all of the safety improvements that we've made to the school throughout the school year, during the virtual learning period, and what's to come. We can't wait to have you all back, and if you have any questions, please don't hesitate to ask. We'll see you soon.